Baltimore General, an episodic medical drama, written by Blue Bolton. Episode 1, Transfer of Care, Chapter 9. Emilia inhaled deeply, steeling herself as the weight of the diagnosis settled between them. We found evidence of ornithine transcarbamylase deficiency, OTC. It's a urea cycle disorder that causes ammonia buildup in the blood. Shaw's face remained impassive, cold as marble. And how does that explain his internal bleeding? It doesn't directly, but patients with metabolic disorders often have multiple system involvement. Emilia's fingers tightened around the chart. The metabolic team strongly advises against surgery right now. The stress could spike his ammonia levels even higher and cause irreversible brain damage. Shaw stepped into her space, close enough that Emilia caught the faint scent of antiseptic soap clinging to her skin. He's bleeding into his abdomen, Carter. If we don't find the source and stop it, he'll die before the ammonia has a chance to kill him. We can support him with transfusions and factor replacement while we get his metabolic crisis under control. Emilia held her ground, refusing to step back. The metabolic team is on their way up now. The metabolic team isn't standing here, watching his pressure drop while his abdomen fills with blood. Shaw's eyes flicked to her watch, the movement sharp and dismissive. I gave you an hour. You found something interesting, but it doesn't change the immediate threat. Alex appeared at their side, his tablet casting a blue glow across his worried face. BP's down to 85/40. Hemoglobin dropped another point despite the transfusion. Shaw snatched the tablet, her eyes darting across the numbers. He's bleeding out. We need to go now. Emilia felt control slipping through her fingers like sand. At least let me get the metabolic team's input on how to manage him perioperatively. We can minimize the risk if we... There's no time, Shaw cut her off, the words like a blade. He needs surgery, and he needs it now. She pivoted toward Alex. Call the OR and tell them we're coming up, and page anesthesia for an emergency case. Emilia planted herself in Shaw's path, heart hammering against her ribs. If you take him to surgery without metabolic support, you could trigger a fatal hyperammonemic crisis. Shaw's eyes narrowed to dangerous slits. And if I don't take him to surgery, he'll exsanguinate on this bed. Which death would you prefer to explain to his mother? The challenge crackled between them like electricity. Emilia's throat tightened with the knowledge that Shaw was right about the bleeding, even as every instinct screamed about the metabolic danger. Let me come with you, she conceded, the words almost painful. I'll manage his metabolic status during the surgery. Shaw studied her, something unreadable flickering across her face before she nodded curtly. Fine, but in the OR, I make the calls. Understood. Shaw turned, her voice cutting through the tension. Let's move. OR3 should be ready. As they prepared Jordan for transport, Emilia crouched beside Marla, whose eyes had grown glassy with fear. I don't understand, Marla whispered, her fingers trembling as they clutched at her sleeve. How could he have this disorder? Wouldn't we have known before now? OTC deficiency can present with varying severity, Emilia explained, keeping her voice steady. Some people have mild symptoms their whole lives without knowing the underlying cause. The Vascatril might have been the trigger that pushed his system into crisis. But he's been taking it for months with no problems. You mentioned his dosage was recently increased? Marla nodded, a tear slipping down her cheek. 2 weeks ago, his migraines were getting worse. Another puzzle piece clicked into place. We'll know more after surgery, Emilia said, squeezing Marla's hand. You can wait in the surgical lounge. Someone will update you regularly. Marla clung to Jordan's fingers until the very last moment, her knuckles white as they wheeled him toward the elevator. Emilia stayed beside her until they had to separate, the promise to protect her son hanging in the air between them. In the elevator, Shaw's voice cut through the hum of machinery. We'll start with a midline incision, identify the source of bleeding, and proceed from there. Anesthesia is aware of the metabolic concerns. Yes, Emilia confirmed. They're preparing for potential ammonia spikes. We'll have continuous renal replacement therapy on standby if needed. Shaw nodded, her focus already narrowing to the surgery ahead. The elevator doors slid open with a soft chime, revealing the sterile brightness of the surgical floor. The OR hummed with controlled chaos as Emilia helped transfer Jordan's limp form to the operating table. She stepped back, watching the anesthesiologist slide the endotracheal tube between Jordan's pale lips. At the scrub sink, Shaw's movements were precise and rhythmic, almost hypnotic. Emilia joined her, the ritual of surgical scrubbing momentarily bridging the gulf between them. The antiseptic soap stung her cuticles as she worked it methodically up her forearms. "Have you seen OTC deficiency before?" Shaw asked, breaking the silence. "Once, during my fellowship," Emilia replied, surprised by the question. "Adult male, presented with altered mental status after starting a high-protein diet. We caught it early." "And he survived?" "Yes, with dietary management and medication, he did well." Shaw's mouth tightened in what might have been acknowledgement. "Good to know." They entered the OR side by side, arms held aloft as nurses helped them into sterile gowns and gloves. Jordan lay exposed and vulnerable, his skin prepped orange-brown with betadine, his vital signs flashing on the monitors above. BP 80/35, heart rate 135, the anesthesiologist called out. He's tachycardic and still hypotensive despite 2 units of blood and pressors. "Let's move quickly," Shaw commanded, her palm outstretched. "Scalpel." The blade glinted under the surgical lights as Shaw made a clean, decisive cut from just below Jordan's sternum to his pubic bone. Emilia positioned the retractors, exposing the abdominal cavity. Blood welled up immediately, dark and thick, pooling around Shaw's gloved hands. "Suction," Shaw ordered, her movements never faltering. "There's at least a liter of blood in here." As they cleared the field, Emilia noticed something strange. The blood looks partially clotted in some areas, almost gelatinous. "That suggests the bleeding has been ongoing for some time," Shaw murmured, probing deeper. "Let's check the spleen first." They worked in tandem, examining each organ methodically. The spleen appeared intact, the liver uninjured. "Check the bowel," Shaw directed, shifting her attention to the intestines. As they gently manipulated the small intestine, Shaw's hands suddenly stilled. "Look at this." Emilia leaned closer, her breath catching. A section of small bowel lay darkened, tissue nearly black in places. "Necrosis," Shaw stated, tension threading her voice. "Significant necrosis of the ileum." "That doesn't make sense," Emilia whispered. "Why would he have bowel necrosis?" Shaw's fingers traced further abnormalities, revealing a story written in damaged tissue. "There's extensive bruising on the mesentery, and look here, these tears in the serosa aren't fresh. They're partially healed." Emilia's mind raced through possibilities. Bowel necrosis with mesenteric injury pointed to trauma or vascular compromise, but Jordan had no history of accidents, no conditions that would cause spontaneous mesenteric ischemia. "Could it be related to the metabolic disorder?" Shaw asked, her eyes meeting Emilia's over her surgical mask. "Not directly. OTC deficiency doesn't cause bowel necrosis or mesenteric injuries." Emilia studied the damaged tissue, a cold realization settling in her stomach. This looks traumatic. Shaw nodded grimly. I'm thinking the same thing. These injuries are consistent with blunt force trauma to the abdomen. Their eyes locked, the implication hanging between them like a shadow. We need a full tox screen, Emilia said, her voice barely audible above the beeping monitors, and we should consider the possibility of non-accidental trauma or environmental exposure. Shaw's eyes hardened to flint. Do not start that unless you're prepared to finish it. What does that mean? It means accusing a parent of abuse isn't something you do lightly, Shaw hissed, leaning closer, especially when there are other possible explanations. I'm not accusing anyone, Emilia countered. I'm suggesting we gather all the relevant data. The pattern of injury is concerning. Their gloved hands nearly collided over Jordan's exposed intestine, both reaching for the same retractor. The tension between them crystallized in that moment sharp enough to slice through the professional veneer they maintained. You've been here less than 24 hours, Shaw said, each word precise as a scalpel cut. You don't know this hospital, this community, or this family. Making accusations without solid evidence can destroy lives. And missing signs of abuse can end them, Emilia replied, refusing to yield. I'm not saying it's definitive, but we need to investigate. Shaw held her gaze, something unspoken passing between them before she turned back to the surgical field. Fine, order the tox screen, but this stays in this room until we have conclusive evidence one way or another. Emilia nodded, relief washing through her. Agreed. They worked in focused harmony, Shaw resecting the necrotic bowel and repairing the damage. The mesenteric tears had allowed blood to seep slowly but steadily into the abdomen, explaining Jordan's declining hemoglobin despite the absence of visible external bleeding. BP's coming up, the anesthesiologist announced. 90-50 now, heart rate 110 beats per minute. Good, Shaw said. We've controlled the major bleeding sources. Let's check for any other injuries before we close. As they examined the rest of the abdominal cavity, Emilia's fingers found more subtly discolored tissue on the posterior wall. There's bruising here, too, she noted, her stomach tightening. It looks older than the mesenteric injuries. Shaw's gloved fingers traced the area. You're right. This is at least a week old, maybe more. Multiple incidents? Emilia suggested, the words barely a whisper. Shaw didn't answer immediately, her focus locked on completing her examination. We need to document everything thoroughly. Photos, detailed descriptions in the surgical report. I'll take care of it, Emilia promised. As they prepared to close, Emilia glanced at the monitor displaying Jordan's ammonia levels elevated, but not yet critical. His ammonia's holding steady enough, she noted. The metabolic protocol seems to be working. Shaw nodded, her needle weaving through layers of abdominal wall. Good, he'll need close monitoring post-op. I'll arrange for the metabolic team to follow him in the ICU, Emilia said, and I'll order that tox screen right away. They worked in tense silence, the earlier conflict suspended but not forgotten. As Shaw placed the final sutures in Jordan's skin, Emilia mentally prepared for the conversation ahead. I'll talk to his mother, Shaw said abruptly. We should do it together, Emilia countered. If there are questions about possible trauma, we need to present a unified front. Shaw's jaw tightened visibly before she nodded. Fine, but let me lead the conversation. They found Marla pacing the surgical waiting area, her face etched with hours of worry. She rushed toward them, hope and fear battling in her expression. How is he? Is Jordan okay? He's stable, Shaw said, her voice gentler than Emilia had yet heard it. We found the source of bleeding and were able to control it. Thank God, Marla breathed, her shoulders sagging. Can I see him? He's being taken to the ICU now, Emilia explained. You can see him once he's settled, but he'll be sedated and on a ventilator for at least 24 hours. Marla nodded, then her brow furrowed. What caused the bleeding? Was it the medication? Shaw and Emilia exchanged a loaded glance. We found some unexpected issues during surgery, Shaw said carefully. Part of Jordan's intestine was damaged and had to be removed. Damaged? Marla's voice rose, her fingers clutching at the strap of her purse. How? That's what we're trying to determine, Emilia said. We're running additional tests to help understand what happened. What kind of tests? Blood tests to look for toxins or substances that might explain his symptoms, Emilia explained, watching Marla's face. And we're examining the tissue we removed for clues. Marla's eyes narrowed. You think he was poisoned? We don't know yet, Shaw interjected. We're exploring all possibilities. Marla looked between them, her expression morphing from concern to something harder, more defensive. You're not telling me everything. Shaw inhaled deeply. Mrs. Hall, the type of damage we found in Jordan's abdomen can sometimes be caused by trauma, an injury of some kind. What kind of injury? Marla asked, her voice dropping to a whisper. Blunt force trauma to the abdomen, Shaw said evenly. The kind that might come from a fall, an accident, or what? Marla demanded, her hands now clenched at her sides. Or from being hit, Emilia finished, keeping her voice neutral even as she watched Marla's face drain of color. Marla stared at them, comprehension dawning in her eyes like a terrible sunrise. You think I hurt my son?